After we deliver a trust transfer to the patient, showing them the picture of their problem, telling them the problem from the Healthy Mouth baseline, and sharing with them the concerns that we have or the consequences of doing nothing, we're quiet and we wait for the patient to talk. There's 3 things that the patient can say: yes, yes but, and no. A patient who can understand that this is their tooth, this is their problem, and they understand the consequences of doing nothing, will engage in conversation, asking, what can I do to fix this? That patient is a yes patient. They're ready to move forward with fixing the problem.
Okay, so here's a photo that we took, and I know I told you I took some up-close photos.
That's me? That's my mouth.
That is your mouth.
Wow. Okay.
As you notice here, there's a few cracks. This large silver filling starting to leak down. And I know you said you had some pain right here, and that is actually that tooth that's on that side.
Okay. Yeah, I had no idea that it was that bad or that it looked like that. I mean, you know, when you're looking in the mirror, you can't really. I guess you don't see what you can see on the screen. So,
right.
Yeah, it looks painful. So that might explain a lot.
Right. If we don't fix this, it's just allowing infection to leak back into your mouth, which goes through the rest of your body. It's really unhealthy for you. And as the cracks continue to get larger, the tooth could break, and eventually that could lead to losing the tooth if a lot of the tooth breaks off.
So, I mean, what do I need to do to fix that? Because it just looks horrible. I mean, it looks awful, I am concerned about that. I didn't realize it was that bad.
Well, what Dr. Estep would do is she would take out this large silver filling and remove any infection that's present in the tooth. And then we'd take an impression of a custom fit porcelain piece that would go in that spot where that large filling is, and it would make the tooth stronger. So this tooth will end up being stronger than it ever was in the first place whenever this first filling was put in that tooth. Dr. Estep, this is Vanessa.
Hi, Vanessa. I'm Susan Estep. So nice to meet you. Welcome to our practice.
Thank you.
Vanessa is a singer.
Awesome. Very cool.
So she's wanting to get her mouth healthy and look beautiful for all of her audiences.
What kind of singing do you do?
I actually sing in a wedding party band and play
like
guitar and, you know, working on some coffee house things. So
That is so cool.
it's very fun.
So Dr. Estep, we took a few photos, and this tooth on her lower right is bothering her. She's having some pain, and we went through the Healthy Mouth baseline, and she notices some things that she wants to talk to you about.
Okay.
And that tooth right there is giving her some pain, and she's noticed it kind of looking like she wants to get it restored.
Okay. Very good. So I kind of see what you guys see in that that looks really unhealthy. It really concerns me that it's hurting because just this situation without any kind of sensitivity can be, you know, a really unhealthy scenario. But the fact that you're having some pain with it is a real concern. I see Courtney pointed out the leaking fillings and the cracks going through the teeth, and shared the concern that means there's decay or a new cavity back in that tooth that if we don't do something about it is going to get worse and worse and worse and cause more problems. It sounds like you guys talked about resolution for this, and that's great. You know, I congratulate you for taking control of your teeth. Health is very important in connection with your overall health. Congratulations on getting that started.
Yeah, I'm ready.
Do you have any questions or concerns for me about getting that fixed?
I was talking to Courtney about the insurance. I do want to talk more about that, and she said that there was someone that I could talk with about. And I guess I really want to get started. I want to be as healthy as I can be, and when she pulled that up, I just had no idea. So
terrific. Well, when we blow things up like this, oftentimes a picture says 1,000 words, and I hear you saying that you're want to learn more about the investment and about the discount that insurance will provide, Julie's fabulous. She has an amazing way of being able to fit this into your lifestyle, especially as a singer, wanting to look good and feel good and make sure that you don't have any emergencies crop up. So any more clinical questions or concerns at this point?
No, I think I have a pretty decent understanding, as much as I can, and just ready to get some things started.
Great. Well, welcome to our practice. It's such a pleasure meeting you.
Thank you so much.
All right, Christine, Vanessa's all finished. You can have a seat right here.
Good to see you again.
Yes, you too. So we talked about the lower left's giving her some pain and some problems, so we're going to go ahead and get that fixed with a porcelain filling that Dr. Estep recommended, and she has a few questions about the investment and some insurance. So I told her you would be great to answer all those questions.
Thanks, Courtney. Yeah, I'll definitely take care of that.
All right.
Okay. So Vanessa, as you can see on your photos, there's some cracks and a little bit of leaking around that filling. So we just want to be able to replace that for you. That'll help get you out of pain. What we'll do is put a porcelain restoration in that area, strengthen the tooth back to almost how it was before you.
Okay.
Okay. So right here, we can talk about your investment a little bit. The investment for that porcelain restoration is the $13.89. Okay, so what we can do is figure out how we can fit that into your lifestyle. Dr. Estep offers a pay-to-day courtesy, so if you go ahead and you're ready to schedule that and we take payment today, she'll give you 5% off of that treatment plan. Okay? So that'll make your investment just a little bit less. All right. Do you know when you'd like to put that on the books and when we can get you scheduled for that appointment?
I did have a quick question about insurance.
Absolutely.
As I know I have dental insurance, I'm just not really sure.
Absolutely. So what we do here is we're fee for service, which means that we'll collect the full investment up front, and then your insurance company will reimburse you your portion.
Okay.
So you can expect about a 50% reimbursement to them, up to about $1,500 per year.
Great. I think that's something I can definitely do.
Okay.
So I'd like to go ahead and get started as soon as I can.
Absolutely. Let's get you on the books for that.